Hello again, this is Lynn Fabia, and I'm with Dr. Peter Hofmann, and we're discussing his second book. He's a published author of Dentistry, Xposed. Dr. Hofmann has been practicing dentistry for 43 years. Today, we're going to talk about different myths. So, many people use baking soda and salt to brush their teeth because that's what they used to do before. And they think it's more natural to brush their teeth with baking soda or salt, but is this a myth?
You can clean teeth with baking soda and salt or salt, but it's very abrasive. And the new formula for toothpaste is nanoparticles of baking soda anyway. So it works better to use the small rounded particles. It's safer for your teeth and gums and bone.
Okay.
So you should use the toothpaste.
Yes, rather than using baking soda every day, which would be abrasive. Talk about the value, and you discuss this in the book, and the importance of saliva in the mouth.
Well, saliva maintains the health of the mouth. It helps you to swallow and chew food. It protects the tissue from friction. You'd be amazed how much friction is involved. When people have a dry mouth, they have bad taste, they have sores, cells don't do well. They tend to become brittle and fall apart. So you can have sloughing of tissue, your tongue can smell pretty bad, and it's just a lot of mouth odor and a lot of other problems.
You need that moisture.
Yeah, you do
saliva.
need it, yeah.
You also talked about drug companies producing over 500 medications and drugs, which can actually produce dry mouth, which a lot of people say it's hard to eat because of the dry mouth, and it turns into gum disease and it can turn into decay. Would you elaborate on that?
Well, that's a really good example of what I would call manufactured disease. We have a top-down pharmaceutical business that produces drugs that could make them money, and they could care less about the mouth. Normally, that's why you see so many drugs that cause problems with the mouth. And I'm glad you asked that, because recently someone was telling me they take Benadryl every night to help them sleep, but that dries the mouth out. See, and they don't even realize how much damage they could be doing.
More damage. And
this is a problem. Doctors, physicians don't warn patients about that, and they'll say, hey, take some Benadryl. But you have to warn people, and that's one reason why I wrote the book, to warn people about these issues.
Yeah.
And even antihistamines dry the mouth.
That's what I was going to ask you next, was what were some of the drugs that do dry the mouth? Ibuprofen is what you said in there.
Yeah, there are a lot of drugs that we use every day that can cause problems. And I just mentioned antihistamines. But a lot of the big drugs that we use for controlling blood pressure, for controlling
dry mouth.
Yeah, that causes dry mouth. So we have to be careful on those. When you take a lot of those medications or drugs, you should try and wake up at night. Well, you probably aren't going to wake up at night anyway. When you do wake up, drink some water.
That'll help.
It helps.
Drinking lots of water after you take medication helps, so it doesn't stay on the liver and other organs in your body. You need to flush it out.
Well, that's true too. But you want to provide fluid flow in your mouth. Water, drinking too much water can actually also be a problem, but it's good if you are, for instance, during the day having a lot of thirst. You would want to try to not sip all day. Just drink some water, like you would normally drink water. Drink a cup of water. But don't be sipping all day long, because that can affect the saliva in a negative way.
Because it interferes, probably.
Yeah.
It's not balanced.
Right.
When is it balanced and when it is not?
Mm-hmm.
So you also, after this, go into eating habits. Of course, we should avoid excess sugar, processed carbohydrates, acidic foods, which is basically what people do when they're snacking in between meals. But you write about a solution that is to drink plenty of water. especially after you've had maybe apple cider vinegar in salad dressing or wine or juices. Would you talk about that again a little bit more, about water?
Well, when you eat something, let's say you go out to eat, and you have that water sitting at the table that you may not be drinking, but you should. After you finished eating, drink that water and slosh it around in your mouth. It will knock out the acids. When you're snacking, have a cup of water nearby. You just want to control the sugar, the carbohydrates that stick to the teeth and the acids. You want to neutralize it.
That's why the water is important
Yep.
to help flush it out and
Yep.
not let it sit and turn into
Yep.
decay, or it sits there, they take a nap or something, and then they have all these problems.
Mm-hmm.
And one more thing I wanted to cover in this particular interview was you talked about mouth
Odors.
odor, halitosis.
Mhm.
Is that because of dry mouth? What causes that?
Well, there are multiple causes. Dry mouth is one, but a lot of people have wisdom teeth, and we can form pericoronitis around the gums, or you can have gum infections anywhere in the mouth, and that could cause a mouth odor. But another big factor in mouth odor is the formation of a fungus-like growth in the mouth, like yeast, other infections like that, that on the tongue and elsewhere, and it's releasing hydrogen sulfide, and hydrogen sulfide causes the worst mouth odor. So chlorine dioxide neutralizes it. It's the one mouth rinse that can neutralize mouth odor. All the other ones that I recommend in the book, Listerine, and some of the fluoride mouth rinses, but you can even make your own, but they don't knock out the mouth odor as well as chlorine dioxide does. And if you mix zinc phosphate with it, it does even better. So zinc phosphate aids in the potency of the chlorine dioxide. So toothpaste with zinc phosphate, or another mouth rinse with zinc phosphate, and combine the two. You can rinse with one and then rinse with the other. There's nothing wrong with rinsing with two mouth rinses.
Okay.
A lot of people don't think of that.
No, they don't.
But you can do that. A cheap Listerine mouth rinse with chlorine, zinc chloride.
Will help.
There's a brand new one that just started to be manufactured. It's a gum therapy with zinc chloride. And you can use that instead of zinc phosphate and mix it with the chlorine dioxide.
Well, how interesting this is. Well, will you come back and we'll talk again about some other things in your
Sure.
very revealing book?
Sure.
Thank you, Dr. Hofmann.
You're welcome.